Welcome to Talking Treatment, the podcast that features healthcare experts, industry leaders, and treatment center providers from around the country, sponsored by ASLE. I'm Tom Patton. On this episode, I'm talking with Michael Coryea. Michael is a board-certified psychiatric mental health nurse practitioner and the CEO and founder of Roadways to Recovery based in Indiana. Michael, welcome to the program.
Thank you.
Tell us a little bit about Roadways to Recovery and the psychiatric mental health services that you provide.
Like you said, we're based in Indiana, to be more specific, more in the Bedford area, although we have expanded out into Terre Haute, Indiana as well. So we just actually purchased a couple buildings there. We provide addiction treatment and mental health services. Our model has been primarily telehealth so far. That's allowed us to reach people all across the state of Indiana, and we've experienced a decent amount of growth in a short period of time due to this. It's very accessible for everybody in the state. People also, in their busy jobs and are able to do it right there at work, which makes it very convenient. Some of the things we provide is not only just mental health services, but we provide addiction services as well. So we provide all the MAT treatment, things like naltrexone with Vivitrol injections, Suboxone. We even do some Sublocade injections in our Anderson partnership, Camprol, et cetera, for those with addiction. And we provide actually programs with an array. We try to go through and fill in all the gaps that come through with mental health and addiction, because there are so many. Unfortunately, there's not great systems that do it all. So we kind of help try to fill that in with our strength, and our big strength is our providers. We have several psychiatric mental health nurse practitioners, which is a big scarcity in the times that we live in at the moment. So we provide, at the residential level, for instance, we have a partnership with a company that does it down there in Henryville, Indiana. We do all their psych prescribing, for instance. We do it all virtual, so they actually do the detox in that location, which we are able to do that as well, but they already had a group that did it. But they're like, Michael, we really need somebody we have so many mental health problems with our clients that we're having, the comorbidity rates of those with addiction is so incredibly high. Just PTSD alone, over half of all women, for instance, have PTSD that have addiction. We're not even getting into, all the bipolar, the schizophrenia that we get into, of course, the depression and anxiety that's extremely common. So I said, yeah, you know what? Absolutely. We'd love to help you out with that. And since we've done that, we've only been doing it now for about 2 months. And they said, you know what? We are so thrilled with being able to have these services because our client satisfaction levels have gone up. Our they call it ASA against, I'll be honest. I always call it AMA when it's in the hospital. They call it ASA, but I'll be honest, it's slipping my mind on what ASA is. It's against staff advice. That's what it is instead of medical. But anyway, point being is they turned around and said, hey, our rates are down for this. We don't have we haven't had hardly any crisis for mental health that's been there. They're very limited. Every once in a while we get one on the weekend when you guys aren't there, but it brought it down. So that's one of the big things that we want to be able to offer to other organizations that are doing addiction as well whenever they have, because we know that that's not an exclusive thing. Most of the people that you treat with addiction have a mental health disorder as well. There's an etiology a lot of times of what is going on, of why they started using drugs in the first place, or if they even started and then they end up in bad situations that ends up putting them in a position where they have problems. So we bring that and try to bridge that gap with mental health and with the addiction realm for those that are already doing addiction. And we also in our group specialize in both doing the detox ourselves as along with the mental health, which we do all this in the outpatient as well. So we have our own outpatient services that we do, and we provide both of those services either exclusively or combined with those services. And then we turn around and do it at other levels of care as well. So we work also with a another one here in Indiana that's a hospital 4.0. They also do a residential and a PHP level, and we actually do the detox in the hospital along with the mental health medication management services there. And then we do the psych just for their residential care and their PHP level. And then we have a partnership in Anderson, Indiana, where we also do our own PHP program up there along with IOP programming. So, and then of course, like I had mentioned previously, is that our outpatient services, we do it throughout the state of Indiana. And so all these places that are discharging don't have to sit there and try to search for especially areas where everybody's in. They can actually refer them to us, and we can do it anywhere in the state. And it's very convenient for those that a lot of people don't have transportation, for instance, but they have a smartphone, and you know, everybody has a smartphone. So we use the smartphones, able to do it right there on there. We use several different types of media to come through with. So we use Zoom, for instance. We use some of our providers also use some DoxyMe just to be able to get it in. So it's worked very well with it. It's simple. There's a link, click it. It's about all there is to it. So it makes it pretty simple for them. But our big thing, like I said before, was really filling in those gaps as it comes through treatment and doing so effectively and also quickly. You know, when you come out of a program, you know, they may give you 2 weeks of medication. Well, that's not much time to get into a prescriber. We have made it so far where we're able to actually get people in within 2 weeks of time, which is pretty impressive for the landscape if you know anything about it, because most places are 6 weeks to 3 months or more to get into a psychiatric provider. And we do treat children as well. So we actually treat children, adolescents, and adults all through there. So we kind of hit all those age groups.
I understand you're also beginning to introduce in-person services in Greenwood and Bedford this year.
Sorry to correct you on that part, but Greenwood, no.
Okay.
Bedford and Terre Haute, yes.
Okay.
So we do have in Bedford, we have our office that's supposed to be opening up this summer. Same with Terre Haute. We actually just bought that building, and we should be having it open this summer as well. So we will have in-person services at that, which, you know, adds a dimension that I think is needed, especially when we're doing PHP and IOP services. I think you really need to have some components of in-person there. And we do it in Anderson, Indiana already. So we have a partnership with Grace Wellness and Recovery, and we do it there. And they actually have a PHP, IOP, and sober living. So they have 70 beds of sober living there. And we actually have now sober living services in Bedford, Indiana, and Terre Haute that are open.
So, Michael, how do you make your patients comfortable with the virtual meetings?
You know, just like we do anytime that you work with somebody in person, is, you know, you have to get it's kind of like a meet and greet. You know, you got to get that therapeutic environment set up that they feel comfortable to speak with you. And a lot of that is speaking with them, getting to know them, and putting people at ease. So, you know, that's just even when it's in person, that's part of what we do. I did a lot of inpatient. You know, I worked with a lot of people that were, you know, paranoid at the time, for instance, and come to me, or have delusions, you know, that somebody's trying to poison them, et cetera. And, you know, part of the skills that you have to learn, especially when you're in psych, is for them to trust you. They're not going to talk to you if they don't trust you. Mm-hmm. You're part of the conspiracy, maybe, you know? So, you know, part of that is being able to really speak with people, get on their level, and being able to be personable with them. And that's the same thing that we do through Zoom as well, is that, you know, part of our conversations all in the beginning is being able to put people at ease. They have to feel safe with you. It's one of the big things you have to do in an environment. And then they have to feel like whatever treatment that you're prescribing, you know what you're doing, and it's the right treatment that comes along. And you have to have their input. So we always do personalized treatment.
One of the services you provide at Roadways to Recovery is medical assistant treatment for opioid use. So do you offer that service online or in an inpatient, rather in an outpatient clinic setting?
We do offer that actually online. So like I said previously, Our MAT treatment with opioids using Suboxone, or we also use naltrexone. We do that online as well. Like I said, I think it makes it very convenient for people, especially those that are working. You know, it's hard to take off work when your boss wants you there, and they're not very happy. So they're much happier when you can go take a break and you can do it right there on your phone at work, and you don't miss work. I've had them do it in the parking lots and everything else, you know. So, you know, we start looking at, definitely there's a question there about HIPAA, but that's why they go and segregate themselves in their own area, and they're the ones that are doing it, that it comes along with that. So we're not the ones presenting it in an open area. They are going off and making that where it's private for them. Now, in person, we do in Anderson, Indiana at the moment with our PHP program, we do some outpatient detox there, and we will be doing it also here in Bedford and Terre Haute, like we had just discussed, when we do it in person coming up this summer.
Let's talk for a minute about prescribing for controlled substances. Are there some policy changes on the horizon that you're aware of, and how are you preparing for those?
Very good question, because as of May the 11th, you know, the pandemic is closing as well. They're saying it's closing. They will no longer recognize it as that anymore, the health emergency. So they have 180 days from that point on that, you know, all our telehealth laws as they are with the waivers and everything are still in effect till then. After that, you know, a lot of places now are putting it in policies though, because it was so, to keep it going, because it was so beneficial to people, and we were able to reach so many more people with services. So for instance, the DEA now had proposed it, as far as I know it's going to be going through, is that they basically said now that you can do any controlled substance except for Schedule IIs, which are things mainly like stimulants, that are able to be prescribed via telehealth. No other changes, anything else has to go along with that. Schedule IIs, they're saying that you have to have either an initial in person or a referral from another physician, which makes it very accomplishable for us to do it, because the majority of what we're going to get when they do it is they're going to be referring from another provider, which meets our criteria. So they were dropping the, you know, seeing them every 6 months and having to do the first in person, which makes telehealth a much easier thing to do with controlled substances. So it makes it feasible, where, you know, what they had before was more restrictive than what we have that's coming up. So if they get that through, like it looks like they're going to, telehealth with controlled substances is definitely something that we'll be able to.
What role has technology played in the growth of your organization?
Well, in our organization, because we're basically doing everything telehealth at the moment for the most part, has been tremendous with it. Like I said, we are able to use our providers in different parts of the state that are able to still do anywhere in the state that we need them. For instance, you know, I've got some that live in Indianapolis. I've got some that, like I said, live down where I live at, more in the south of Bloomington area. I've got some out in Nashville. We've got them in Terre Haute, Evansville, you know, different Columbus, different cities throughout the state of Indiana. It enables us, though, to still get talent in there and be able to get it, because it's hard to find enough psychiatric providers all centered in one small area. And not to mention, client-wise, it enables us to encompass the whole state because of telehealth. You know, and especially, you know, Indiana's pretty rural, you know, so there's a lot of different areas that makes it very difficult for clients to come to see you. I mean, it could be the closest provider may be over an hour away, you know, for psychiatric services. And you know, if they're able to do it, and thankfully we've came a long way with internet now, with high-speed internet, and you know, they're able to do it from their homes, even in a lot of times in very rural areas. They still have a lot of them have fiber, thankfully.
I've heard from doctors and nurses and even seen it in medical offices that many healthcare providers use a lot of different vendor softwares to get their clinical and e-prescribing done, and then another software vendor to complete the billing portion. Many work off paper still and have paper charts or spreadsheets to manage. So it sounds like you may have mastered that.
Well, we're certainly trying. So, but yeah, we've used Asley as our record, our EMR, and it's been great for us. Their platform is a cloud-based system. We're able to log in anywhere that we go. They have a lot of nice features that enable us to communicate easily between us. They have the telehealth portions built into the record as well. You definitely have to have a record that's going to work for you in the setting that you're doing it for, or it becomes a huge headache. If we were doing a paper right now, we would be in big trouble. The amount of it just wouldn't be feasible to do it really telehealth with paper. Believe it or not, there are organizations that are still using paper, and the amount of trees they're probably taking down, I couldn't believe. But either way, and it also has to be, have the features you need clinically, and it's also got to be budget friendly, especially when you're starting up. That's part of the reason why we chose Asley as our record, is because it was those things. It had the clinical that we needed for mental health and addiction, and then financially it was budget friendly for what we needed to start off with. Some of the records are quite expensive to really start off. People all want everything in a record, but then when they start really looking at it, you're like, oh my goodness, the cost is astronomical to get all that, especially, if you're a small business. It can be definitely cost prohibitive for that. And it has all the e-prescribing features that we absolutely need in there that comes through to make this viable.
Speaking of being an entrepreneur, because you're a fairly young man and you're the CEO and founder of a health company, what are some of the challenges of being an entrepreneur in the mental health care space?
Well, some of those, just like any other industry, is finding the right talent. And mental health is definitely hard to find enough talent and good talent that comes through. And, in the environment that we're in, because there is a shortage, it's great for business. However, it also makes it hard to find enough people to be able to do what you need to do, and to be able to pay them the right salaries to be able to attract those people. Right. There's a small margin that comes through from what you can pay and what you're collecting and so forth. So I think that's one of the first challenges that comes out. The other challenges is definitely in anytime you're in healthcare is the amount of regulations that we have. It's an ever-changing environment. Like we were just talking about healthcare laws changing with telehealth. That's just one of the components that, you get with them. Insurances are always changing what they want. All the records you have to have, which of course we use Asley that comes along with that, but making sure you have all those records and everything's compliant and it has everything that's in there. 42 CFR, you have to make sure it's in your consent. You have to have releases of information. You got to make sure it just keeps going on and on. So I think that's kind of some of the challenges that come along with it. Is a lot of it in the healthcare industry is all the regulations you have and being able to mainly find talent that does a great job and does so where you can afford them. So for what the reimbursement rates that you get, you get into billing, which we also use, the company there with Asley for our billing, and billing's another one. You got to make sure you're getting reimbursed. Otherwise it doesn't do you a whole lot of good. Nice to do services, but if you're not getting paid, you're not going to keep anybody. You're not going to be able to, do those services for people.
You're in Indiana. Do you have plans to expand beyond that, or are you just wanting to be right there in that state and serving them?
No, we have plans to actually move on to other states. Actually, I was speaking with our COO last night, actually, Kimberly Heiser, and she had seen some legislation that actually just came up with Kentucky. Kentucky, of course, is one of our neighbors. I live in southern Indiana anyway. We actually have some providers that all have Kentucky licensing as well. It's probably the next place that we're going to be end up going to soon. They just actually are enacting a new law that enables it where you don't have to technically be in the state, and you're able to telehealth into the state and be able to charge and do your services there all throughout the state of Kentucky, which is a great benefit. Indiana is another one that I've heard that legislation that's coming through. Hopefully they get it signed. Is it cuts down our time for credentialing, which is right now to get a provider credentials about 4 months. So by the time you hire them, by the time you're actually able to bill, we're talking like 4 months, which is, that's a third of the year already gone after you told somebody. So Indiana hopefully is going to be the pioneer in getting it where you get in there and they actually let you go ahead and start billing essentially right away once you submitted your applications, which will be a beautiful thing. And hopefully that'll be our new future, is being able to cut down all the red tape that comes along with it, of being able, so that we're able to treat the disparity that's there. There's such a gap in care, and it isn't just Indiana, it isn't just Kentucky, it's throughout the United States. And being able to get the talent that we do have available and be able to move it throughout the United States with the technology that we have, I think is going to be able us to treat many more people that need it.
Michael, we're just about out of time. Is there anything else you'd like our listeners to know, or would be of interest to other psychiatric nurse practitioners or other treatment center owners and operators?
When I went into this, there was a lot of things I didn't know. I learned a lot along the way. I certainly recommend trying to find somebody, if you're trying to get into this, that really knows what they're doing when they've done it before. It's one of those things, in my experience anyway, in the healthcare, is when you come up against other people, they don't like to tell you a lot of the information, or B, there's lots of people that know a little bit of information, but they don't know all the picture that comes along with it. So I think definitely doing a lot of research and being able to do it, it's a great thing. We certainly need the services. It's unfortunately not as easy as turning around and going, hey, my business is open, come and see me. If it was, we would definitely be able to serve a lot more people. There's definitely a lot of regulation that comes through, definitely a lot of planning that has to come through, time consuming, cost. Probably why everybody doesn't do it. So
it's the classic story of entrepreneurship. You don't know what you don't know when you get started, and it's always a learning curve, doesn't matter what it is.
Absolutely.
Michael, thanks very much. I really appreciate you taking time out to talk with us on Talking Treatment. Thanks again for joining us.
Yeah, thank you, Tom.
Michael Coryea is a board-certified psychiatric mental health nurse practitioner and the CEO and founder of Roadways to Recovery, based in Indiana. Talking Treatment is produced by Broadreach Communications and Asley. Asley offers an all-in-one solution for behavioral health care and addiction treatment providers. Visit asley.com, that's AZZLY.com, to schedule a free consultation with an Asley expert today. And be sure to subscribe so you don't miss an episode. I'm Tom Patton. Thanks for listening.